This is a PowerPoint presentation on viral and bacterial rashes for Nursing 687 by Angie Odell, Tanya Otto, Amy Popa, and Allison Saylor. Roseola is also known as 6 disease. It is caused by the HH6 and HH7 virus and can cause encephalitis in immunocompromised patients. Humans are the only known natural reservoir for this virus, and it's spread via the oral, nasal, and conjunctival routes. This can be spread prenatally, during, or after birth, and is more commonly seen under children under 2 years old. Roseola has no gender preference. It is seen worldwide, and it is seen in every season. Children are most contagious during the fever period, and once the fever begins to decrease, the characteristic rash will soon appear. So once your child has been exposed to roseola, it takes 5 to 10 days before the initial symptoms present, and those typically will be a fever of 101 to 103 degrees, so a high fever for 3 to 7 days, and it can reach as much as 105 degrees, at which point you're going to want to be monitoring for febrile seizures. Get Tylenol and Motrin on board for these kiddos. Other complaints they're having are a sore throat, runny nose, cough, swollen lymph nodes, and decreased appetite. Once the fever breaks, the rose-colored rash begins to spread from the trunk to the extremities. And roseola is diagnosed by clinical presentation. There's really no test. It's caused by a virus, so antibiotics, of course, are not needed. And it's just symptom treatment. Make sure to get Tylenol or ibuprofen on board for these fevers and body aches. Educating parents on making sure that the child is getting plenty of fluids, especially during the febrile period. So it's basically the goal of treatment is to reduce symptoms. Fifth disease has that characteristic slapped cheek appearance, and it is caused by parvovirus, which is a single-stranded DNA virus, and it's grouped in the same viral category with measles, rubella, varicella, and roseola. It's spread through droplets, primarily by coughing and sneezing, but it's also spread by blood and is very contagious. About 20% of those who contract fifth disease are carriers, and they never present with any symptoms. Fifth disease is worldwide, and it's spread year-round. 20% of children will have no symptoms until the characteristic rash appears on the cheeks, which usually takes 4 to 14 days post-exposure. The early symptoms of fifth disease are low-grade fever, headache, runny nose, sore throat, nausea, vomiting, diarrhea, and the slap cheek appearance usually lasts 5 to 10 days, and then it will spread to the trunk and the extremities, which usually lasts 2 to 4 days, and it has more of a lacy appearance. In about 10% of those affected, it will cause joint pain and swelling. Fifth disease is diagnosed on clinical presentation. There's really no testing for it, and again, we're going to have symptomatic treatment. It's a virus, so no antibiotics. We're going to be given Tylenol and ibuprofen as needed, and making sure that we're educating parents and patients on increasing their fluids. Make sure we're washing hands to prevent the spread, covering sneezes. Don't touch your eyes, nose, or anything, and stay home when you're sick. Herpes simplex is a virus that when it's active, it causes infections on the skin and mucous membranes. It can lay dormant in the body for long periods of time and then be brought out by stress or illness or an attack on the immune system. And 2 types of herpes. HSV1 is often referred to as what we commonly talk about as cold sores, and HSV2 is referred to as genital herpes. So on this slide, you can see various areas of the body where herpes may show up. Herpetic whitlow on the fingers typically are your warts that you're going to see on people's fingers. And HSV2 is genital herpes on the labia or the shaft of the penis. Herpes labialis is going to be your typical cold sore, a cluster of vesicles on the lips. And then oral herpes, you're going to see gingival mastomatitis, ulcerated vesicles, may cause pharyngitis and lymphadenopathy as well. So the gold standard for definitive diagnosis of herpes simplex is a viral culture. And again, because cultures can take several days to come back, you could consider doing a Zonk smear, which is performed with fluid from the vesicles and it will identify that it is herpes, but not what specific type of herpes it is. There are other tests like the DFA test, the ELISA test, and the PCR test that can be done with severe infections as well. The treatment plan, you're going to look at using Burroughs solution topically to help reduce irritation. And then systemically, typically you're going to see acyclovir given 5 times a day for 5 days. Additionally, if you're suspecting a secondary bacterial infection, you can look at prescribing mupirocin topically and erythromycin or dicloxacillin systemically. Another thing that's great with kids or adults that have herpes in the mouth is magic mouthwash, and that can be swished and spit 3 times a day. It works fantastic to help with pain control, discomfort from herpes. For these kids, you want to make sure that you're educating the patients to make sure that the kids are receiving enough hydration, keeping the affected area clean, and you want to prevent the spread. So huge issues with going to daycare or sharing, bottles, pacifiers, toys, things like that are going to spread this virus. So this kid's going to have to stay home from daycare or school. The lesions can take up to 2 weeks to heal. Scarlet fever is your beta hemolytic streptococcus causing infection. It's spread directly by droplets via respiration, nasal or salivary secretions. It's very contagious, and it often affects children with tonsillitis or pharyngitis. It can also cause skin infections, including impetigo, wound infections, or burns, and it occurs most often during late fall, winter, and early spring. Signs and symptoms of strep throat or scarlet fever include prior exposure. 2 to 5 days post-exposure, you're going to start to see kids with a beefy red sore throat, a fever greater than 101. Typically, they'll have a white film on their tongue and a red bumpy appearance. We call that strawberry tongue. Additional symptoms, sometimes you will see a rash with a sandpaper texture, and it's in the creases of the body. Swollen lymph nodes are also common. Nausea, vomiting, and abdominal pain is sometimes seen as well. The rapid strep test throat culture is going to be how you're going to diagnose. And treatment is going to include penicillin. Amoxicillin is also very effective. For those who maybe have penicillin allergies, you're looking at clindamycin, azithromycin, or clarithromycin. And individuals maybe that are unable to swallow pills or that you question their treatment adherence, you may want to consider giving an IM penicillin shot. And when you're looking at education for the parents, it's important to know, for the parents know that the child is still contagious until they've been on the antibiotic for 24 hours. Your daycares, school, things like that, they're going to need to know that. Tylenol and Motrin as needed for fever or for discomfort. Prevention efforts as far as washing hands, things like that. And if they're not improving in 48 hours or so, or if they're actually worsening, we need to be seeing these kids again and taking a look at what else might be going on. Varicella zoster virus is a communicable herpes virus that causes varicella or chickenpox, as well as herpes zoster or shingles. The rate of varicella outbreak has certainly decreased dramatically since we started the varicella vaccine in 1995. The incubation period for varicella is 10 to 12 days. The infectious period is 1 to 2 days prior to the rash outbreak, and the infectious period lasts until the rash is completely crusted, which is about 3 to 7 days. There's 2 phases. The first one is the prodrome phase, and not all patients will present with this phase. They'll typically have a low-grade fever, headache, backache, just not feeling well, and mild upper respiratory symptoms. And then the rash phase, you crop up lesions that generally start on the scalp, face, or trunk. They're pruritic macules that develop into papules, and then they develop into vesicles. And these vesicles will crust over within 48 hours, and the scabs will last about 5 to 20 days. and the lesions can appear on the mucosal tissue in the mouth as well. So kids with varicella are going to just receive supportive and symptomatic treatment. Antihistamines or oatmeal baths to help with the itching. Tylenol can be given for fever or discomfort. Again, you want to avoid aspirin and ibuprofen as well, because there is a possibility for superinfection there. Children with lesions must be kept home from school or daycare or wherever they go until the lesions are crusted over and dry. And children that have been exposed but are showing no signs, they're able to go to school and daycare. Kids that have been exposed and start to show signs, they must stay home from school for a week. If they don't have a breakout, then they can return to school. It's important to note too that 10 to 20% of vaccinated kids will still become infected, but the vaccine just protects against severe disease. If the child continues to have a fever for 4 days, 4 days after the rash has appeared, it's probably a good idea to have them come back in and be reevaluated. We may be looking at a secondary infection. And keep an eye on the spots too, that they're itching and scratching for a secondary bacterial skin infection. Thank you for taking time to watch our PowerPoint presentation. We certainly hope that you enjoyed it and that you learned something from it. Thank you.